Okay, this video is called Alternatives to Ozempic. Ozempic is a very popular weight loss drug from Gila monster venom-like protein that people are using to lose weight. Lots of people are on it, including some people I know, including some very smart nurses. And they're like, you know, Pete, not everybody's like you, a fucking robot that's going to eat the fucking grass. Okay, we want to enjoy life. We want to enjoy our food. Okay, and you know, like most drugs, Ozempic has a lot of potential side effects. Average cost monthly, if no insurance, is about $1,000 a month. If you got insurance, you could get it as low as $25 a month. But you know, I was talking to a patient who had head and neck cancer of the tonsil, and he was treated with radiation therapy, and he said it wiped out his taste buds, but that there was a benefit to that. He had weighed over 300 pounds, and then he lost weight, lost 150 pounds, and he was happy with that. So I thought we could treat all the patients with radiation therapy to their mouth to wipe out their taste buds, and then they wouldn't eat so much. You know, that's one idea. Dr. McDougall had recommended that, you know, we could treat all these patients, just give them chemotherapy and make them sick, you know, cause nausea, vomiting, and that'll lead to weight loss. Of course, there's bariatric surgery. We could staple their stomach. We could put a G-tube, gastrostomy tube, into their stomachs, and the food could go in their mouth, and then they could have it just come right out of their stomach. We could suck it out with a tube. You know, low IQ people, they often try the paleo-keto diet for weight loss, and they do okay for about 6 months, and then they gain it all back and more, as well as constipation, kidney stones potentially, and who knows what else. A smart person should look around and ask themselves, who is trying to do what I'm trying to do that's been successful? What group of people, what populations are thin? And they'll probably notice that 1 billion out of 1 billion rice eaters are skinny in Asia. You know, maybe I should do that. If you imitate successful people, you got a better chance to be successful. They'll see that the Europeans are much thinner and healthier than Americans, except for when they've got third world Muslims beating the shit out of them, invading their countries, raping them, and killing them. Other than that, the Europeans are more healthy. They see eaters of sweet potatoes, regular potatoes, and other starches are relatively skinny and healthy, including entire populations, like the sweet potato eaters in Papua New Guinea, the potato-eating populations in the past, in areas of Ireland, for example, and South America, for example. They can also look at processed food-eating populations. They're a disaster. Nauru Island are the fattest people in the world. They eat the most tons of processed food. The people in the Marshall Islands are also a fat disaster in health because they eat a lot of processed food. Processed food is high fat, high MSG, MFG, hyperpalatable, with very low nutrients. It makes people fat and sick. Okay, it's like food poisoning. They can also look and see that non-organic foods are bad. The animals might be given estrogenic chemicals with the meats that cause accelerated rapid weight gain. The atrazine's estrogenic, same thing with the glyphosate. The glyphosate predisposes to fatty liver, to leaky gut, all kinds of health problems and obesity, to increasing the risk of diabetes. They can read that high-protein diets tend to make people gain more weight, so you want to eat a low-protein diet. Nathan Pritikin said all fat is bad for health. Dr. McDougall said the fat you eat is the fat you wear. Fat is the biggest toxin in the Western diet. So you really don't want to go down that path. They'll notice if they read anything about processed foods that, you know, the more you salt food, salt does make food taste good, makes it hyperpalatable, but you eat more of it and you get fat. MSG, MFG, you know, monosodium glutamate, manufactured free glutamate, they make food taste good, but then you eat more of it and you get fat. It's not natural. So, gee, it seems like the logical thing to do is eat what skinny people eat, the skinniest, healthiest people in the world. Low fat, low protein. You can look at Durian Ryder. He's coached, you know, tons of people to weight loss. And what does he say? You got to go low protein. James Mitchell comes to the same conclusion. Other people have as well. Dr. Kempner, etc. Low fat, low protein, low sodium, 100% vegan, single ingredient only, whole foods, 100% organic, no oil, no caffeine, no sweets, no alcohol, no marijuana. The same diet that optimizes weight loss also optimizes prevention of hypertension, prevention of diabetes, prevention of atherosclerosis, prevention of coronary artery disease, prevention of cognitive decline, minimizes risk of cancer. So it makes you look good and it makes you healthy. Why wouldn't you want that?